As a part of a much larger parent study of 24 family planning clinics in Western Pennsylvania, researchers Zelandsey et al. Wanted to fill the gaps in research about adolescent and young adult women's preferences in clinical intimate partner violence assessment delivery. They describe intimate partner violence as physical, sexual, or psychological harm by a current or former partner or spouse. The researchers decided to fill these gaps by conducting a qualitative study that examines patients' assessment of their providers' communication skills during their clinical encounters. In order to negotiate access to this sensitive information, they asked both patient and their physician for permission to record the audio of their conversation involving reproductive health and sensitive topics. They decided to record the entire clinical interaction in order to study the whole conversation to reduce bias from study participation. They conducted an exit survey at the end of the visit that would invite the women to participate in a follow-up interview. For those women who agreed to participate, the researchers used a purposive sampling strategy to include diverse experiences in clinical encounters. These interviews were conducted within 4 weeks after the initial audio recording to ensure the patients will be able to recollect their discussion with their providers. 44 women participated in the interviews, though 8 of them did not participate in the initial recorded clinical encounter. The interviewers were trained to ask probing questions such as, what things can doctors and nurses do to make patients feel more comfort talking about unhealthy relationships? The researchers then sent the interviews to be transcribed verbatim, de-identified, and quality-checked by a third party. After those transcripts were coded, the researchers analyzed the codes that were specific to patients describing want and need from clinicians to feel comfortable in order to discuss intimate partner violence. The researchers found that patients described a need for comfort that extended beyond physical comfort and to a need for emotional support from their physician in the form of communication models. For example, the patients desired a more direct tone rather than vague or sugar-coated language. Additionally, the patients prefer their physician to communicate in a way that aligns with a peer relationship when discussing intimate partner violence and other difficult topics. The study was unique in that instead of asking participants in an interview to imagine a hypothetical situation, the researchers were able to have the participant recall their perceptions during a specific clinical encounter. Clinical implications from this study suggest care providers have a more thorough training in communication skills and strategies when discussing intimate partner violence. These skills and strategies will allow patients to experience more comfort during these conversations, resulting in a greater patient satisfaction, increased trust, and an increased sense of partnership with their physician when making reproductive health decisions.